Hello, everybody, and welcome to Finding Your Voice in Prostate Cancer, which is a live panel discussion for you to answer or get some of your questions answered with regards to prostate cancer. We've got a great panel here today, and I want to first thank Bayer for putting this event on, gathering the panelists, and really a great job organizing and bringing everybody to the table. I want to thank our panelists for being here, and we'll learn a little bit more about them in a bit. And I want to thank you for joining us and making this an interactive discussion. So again, we want to know what you want to know about prostate cancer. We'll cover off on the two main topics and then encourage you to use the chat function to ask any of your questions. And while we do a round of introductions, please go ahead and let us know where you're from so we can acknowledge you, country, city, whatever you'd like to share with us. So let's get started with some introductions. Gogs, would you like to introduce yourself first?
Sure. My name is Gogs Gagnon. I'm from Vancouver Island, British Columbia, Canada, and I was diagnosed with prostate cancer in 2017. And here I am.
Thank you. Ian and Judy, would you like to go next?
Yes, my name is Ian Blue. I live in a small rural town called Strathalbyn in South Australia. I was diagnosed with prostate cancer while I was a professor of nursing in British Columbia, Canada in 2006 and had treatment there and retired in 2007, returned to Australia.
Hello, and I'm Judy, Ian's wife. The other part of the blue team, I guess, and certainly very keen to support Ian throughout his journey, and I have done that already, of course, and continue to. Thank you.
Thank you, and we know that the support of loved ones is critical to men and their outcomes, and so we appreciate you being here and sharing your perspective as well. Dr. Svetlana Kobina, would you like to introduce yourself, please?
Yes, thank you so much, Robert. I'm very happy to be here. I'm medical oncologist by training and spent last 20 years working to develop new treatment options for prostate cancer patients in R&D and medical affairs.
Fantastic. Well, thank you again for joining us. And I will start things with a couple slides just to set the stage a little bit. And then we can go into more of a detailed discussion about some of the topics that had been the most interest on the LinkedIn poll. And also, I forgot to introduce myself. My name is Rob Fung. I'm the Director of Digital Health at Movember. Movember is the world's largest men's health charity focusing on mental health and suicide prevention, prostate cancer, and testicular cancer. And so my role is the business lead for our Movember True North website, which has really information-rich resources that have helped tens of thousands of men worldwide. So let's go into a few slides to start with. Movember is here to change the face of men's health. And the reason for that is because men's health is really in a large crisis right now. Prostate cancer is the second most common cancer in men worldwide and the #1 cancer in older men. Testicular cancer is the most common cancer in young men. And mental health and suicide prevention, 3 out of 4 suicides are men. So men are disproportionately impacted by suicide. To put that into perspective, 1 man around the world dies every minute. He takes his life. And so to sum all of this up, men die 6 years earlier than women. And so that really is a health crisis that we want to try to tackle. So next slide, please. So Movember's vision is to have an everlasting impact on the face of men's health. I won't go into too many of the details here, but encourage you to go to Movember.com if you'd like more information. But just a quick overview, Movember has been around for over 15 years, has fundraised over $1 billion globally for men's health, and that money actually goes towards over 1,250 men's health programs in those 3 cause areas. The way that we fundraise is primarily through the Movember campaign, which runs during the month of November, where we grow out our mustaches to raise awareness and discussion and funds for these causes. And so to date, over 6 million men and women have joined us in that. And again, if you want more information, you can go to Movember.com and join us to support that. So let's go into some more details in prostate cancer that can set the stage for the experiences and the journeys and the insights that our panel has to share. First, the global impact of prostate cancer is that 1.3 million men are diagnosed with prostate cancer each year. What that means is 1 in 9 men will be diagnosed with prostate cancer over the course of their lifetime. And so as you think about the men in your life, as you think about your father figures, brothers, uncles, nephews, friends, there's a pretty high likelihood that somebody you know or care about will be impacted by prostate cancer. And then 9.9 million men are living with or beyond prostate cancer. So after diagnosis, they're either monitoring, waiting for treatment, or they've received treatment. And then, unfortunately, more than 400,000 men die from prostate cancer each year. So next slide, please. So the best way to try to help with that statistic of 400,000 men dying each year is that early detection is really the key. Studies have shown that if you detect and diagnose prostate cancer earlier on, your chances of survival are 95+%, versus if you catch it later on, it can drop drastically down to about 25%. And so what do you need to do in order to detect and to monitor and to diagnose? The most important thing is at 50, make sure you have that conversation with your doctor. One thing that they can do is a simple blood test called a prostate-specific antigen, PSA test, that basically tracks levels of this particular antigen in your body. And as they elevate, they'll naturally elevate over time, but if there's a significant spike, it's almost a signal for them to dig in a little bit deeper. And then studies have also shown that if you're of African or Caribbean descent or have a family history, brother, father, grandfather with prostate cancer, then you do have higher risk, and you do want to start having that conversation earlier, for example, at age 45. To put that into a little bit more details, men of African and Caribbean descent actually have a greater than 75% increased likelihood of being diagnosed with prostate cancer, and more than twice as likely to die of prostate cancer. So really important to have those conversations early. And then the last slide, we'll talk a little bit about this through the panel, but I just wanted to set the stage that the quality of life that men are experiencing throughout their journey, from diagnosis to treatment and afterwards, is really unsatisfactory for a variety of reasons. And so there's a lot of opportunity to improve on the healthcare system side, as well as the community and support. And so again, we're grateful for the loved ones that encourage men throughout their journey. So thank you to everybody that has responded in the LinkedIn poll that helped to guide the topics that we'll be discussing today. The 3 main topics that we wanted to cover off are symptoms of prostate cancer, impact of quality of life, and then practical tips that you can take either as a man or with the men in your life. And so across the 2 polls that Bayer has taken on LinkedIn, definitely thank you for the hundreds of people that have responded. And again, this is designed to be a live interactive panel. And so as you have questions, please feel free to post them in the chat, and we'll try to get to them, and I'll try to weed them in as best as I can. So let's get started. Ian and Judy, I'd like to start with you. Ian, can you share a little bit about how you noticed that something was wrong, and walk us through how you were diagnosed and what you were thinking and feeling throughout?
Thanks, Rob. As I said earlier in my introduction, I was working in British Columbia at that time, and in November of 2005, I had a very severe onset pain in my lower abdomen and radiating into my testicle. I felt at the time that it wasn't anything related to prostate cancer. I thought it was an injury that I might have done gardening that day, but I very soon found out after visiting my local physician in the town in which we lived that there was, and he conducted some tests and found that there was some blood and protein in my urine, and so he did the PSA test that Rob was talking about earlier and found that it was 13, which was a little bit on the high side, and he was concerned about that, and so it referred me to a local urologist who's a specialist in looking after these areas of men's health. So from that point, there was a series of very fast-paced things happening. Initially, the urologist felt that it may have been prostatitis that I was suffering from, and prostatitis, for those that don't know, is an inflammation of the prostate gland in men, and obviously it can also cause the PSA to rise. And so he put me on some antibiotics for a period of several weeks. But following that, I returned to him and the PSA was still high. So in January of 2006, I underwent a prostate biopsy, which is a procedure that's a little bit uncomfortable, but not too bad. And they took some samples with needles of my prostate and found that, in fact, there was early stage prostate cancer. And I had at that stage a Gleason score of 7. This is a score that men who are diagnosed with prostate cancer become very familiar with, because it will often determine the type of treatment that you may get. So a series of other tests followed to see if the cancer had spread anywhere in my body, which fortunately it hadn't. So a lot of bone scan work and CT scan work to find out whether it had spread anywhere. It hadn't. And so I started to have discussions with my family and my treating urologist and my physician and a radiation oncologist about treatment options, and ultimately I decided to have prostate surgery in May of 2006 in the town in which I lived in Canada. 3 months after that, the PSA was still rising slightly, which indicated that there was some evidence of prostate cancer still in my system. So I went to Vancouver in British Columbia and had radiation therapy over 7 weeks. Subsequent to that, the PSA was still rising very slightly, and so I made a decision at that time to retire from my job and return to Australia. So here I am, many years later, still alive and able to tell my tale.
Great. Well, thank you for being so vulnerable and open and sharing that journey with us. Judy, can you talk a little bit about what you were expecting when Ian was going through this, and how did you cope with the diagnosis, especially as you think about your 2 sons and family as well?
Yes, thanks, Rob. My initial reaction when Ian had his biopsy was that it was probably going to be okay and perhaps normal, but that quickly became evident that that was not the case. And so I guess my initial reaction was I was quite devastated to know that he was had to undergo treatment for prostate cancer. And his second admission, of course, as he said, was to the hospital in the city that we lived in British Columbia, and that was for prostatectomy. The surgeon called me after that surgery, and he was very confident that it was a successful operation, and that he had got all the margins, which indicated that, the cancer hadn't spread too widely at all. And so I felt fairly hopeful at that stage. So that was, basically my reaction. Thank you.
Great, thank you.
Yes, and concerns about sons, obviously, and how we broke the news to them as well. And I can talk a little bit about that in a moment, if you like.
Great. Yes, I think we can circle back on that. I do want to make sure that we address some of the questions that are coming in, particularly around PSA and routine checkups, early detection, and then also additional risk factors. So, Dr. Svetlana Komido, would you like to share?
Yes, sure. And basically what you said already, Robert, basically to be sure that if you think you have some family history of prostate cancer, you need to be tested by PSA as early as sometimes 45 years old. 50 is a norm, I would say, to get tested if you have the history. As you said as well, if you African American or Caribbean, those patient groups have the highest probably risk rate and sometimes the worst prognostically prostate cancer. And this is something we need to keep in mind and sometimes even suggest to our loved ones to be sure that they are tested in time. I can say a couple of words. I mean, basically, sometimes it's not very much connected to the grades of prostate cancer, but a healthy lifestyle, active lifestyle, sometimes very important, not only in prevention and as a risk factors for any cancer, but really would play a role in how quality of life will be maintained during the time of initial diagnosis of prostate cancer and over the treatment. And I think it's extremely important for us to talk about this and actually educate not only, I would say, patients, but doctors, caregivers, and groups like Movember to be sure this message is spread across.
Great, thank you. And good point also about the healthy lifestyle and the impact on not only the initial diagnosis, but the treatment journey. And that might be a good segue to ask a little bit about Gogs's journey, because I know that you mentioned on your website and in your book that you were fairly healthy before. Can you share a little bit about what you thought about your health before the diagnosis and your thoughts and feelings afterwards?
Absolutely. Well, before my diagnosis, I was diagnosed with prostate cancer in May 2017. I was 57 years old. I was very active. I was fit. I had no health issues at all. I was in the gym 3 to 4 times a week. I rode my bike to work every day. I was active in the martial arts. I had no symptoms. I was sleeping through the night, no concerns at all. And to be diagnosed was a complete shock and really hit me off guard. And I couldn't believe it. I thought maybe the doctor got my test results mixed up with someone else because I'm so active and healthy. So how it started, it was quite a long process for me to be diagnosed. I was getting annual physicals every year, ever since I was about 50. And at one of my annual physicals, my doctor recommended that I also include the PSA test. And I didn't know anything about it at the time, but I was going for a blood test anyway. And I thought, well, why not? We'll throw the PSA test in there as well. Went for my blood work, came back, everything was good. My doctor was very happy, except my PSA was slightly elevated. He wasn't too concerned because it was my first reading. He gave me a digital rectal exam and he said my prostate was nice and smooth and healthy, although it was enlarged, but probably typical as men age. So he said, why don't we just read it again in 3 months? And he said that there's different reasons why it might be elevated. He said maybe recent sexual activity might be one. And I said, well, that's probably the reason right there. So he recommended that I have another one in 3 months and hold off on sexual activity a few days before the test. Went for the test, came back higher. So he recommended that I see a urologist. And basically, he did a digital rectal exam, confirmed the same thing, smooth and healthy, enlarged, but that's probably okay. Sent me for another PSA test, is up higher. So then he recommended that I have a prostate biopsy. This is when you start to get a little concerned about your health. You start doing a little research. Went for a prostate biopsy, and it came back negative, no cancer. So I was quite happy with the news. Not realizing that I probably did have cancer. And I was quite happy, though, that my doctor recommended that I continue with the regular prostate testing, even though I had a negative prostate biopsy. He was just a little concerned, just every 3 months or every 6 months, just to keep an eye on my PSA. So I did that. And over the years, my PSA continued to rise. 5 years continued to rise. And then at that time, my doctor recommended that I have an MRI. Went in for that, and it came back. It indicated that I had a significant anomaly, not just a little, a significant anomaly, and it was outside the reach of the digital rectal exam. That's something that I didn't realize, that it could be out of reach. So this time I had another prostate biopsy, and they targeted that anomaly. And of course, that's when I got the devastating news that I had cancer, and I couldn't believe it, and completely devastated. Basically, I wanted to, as soon as the doctor said cancer, I didn't really hear anything else he said. I kind of assumed the worst. I just wanted to curl up in a ball and hide, and it was just very devastating to hear that news. So that's how I was diagnosed.
Thank you for sharing. And actually, as I know that you're very active and engaged with advocacy and support groups and leading the conversation with other men, what are some of the common symptoms that you've heard as men have been diagnosed?
Well, I've talked to many men since I've been diagnosed, and the most common symptom really is no symptom at all. Most men, they just don't either have symptoms or they don't recognize they've had symptoms. Now, I said I didn't have any symptoms, but only a little later on, I recognized that maybe I did have symptoms, but I didn't really recognize them. And that was my urinary flow was not as good as it used to be as I was in my teens, but I wrote that off as something as normal. I shouldn't really assess myself, but as normal as I age. And the same thing with erections. They weren't happening as frequently as they used to as I was a kid. And I thought, well, just getting older. So I think as men, we need to be aware of any changes in our body and not just assume that it's normal without seeking professional advice. So basically, of the men that did say they had symptoms, they were all around urinary control, as far as frequent urination, painful urination, blood in the urine, and unable to maintain or achieve erections. That's really the bulk of what I've heard from men. And I know as men we don't. And I know as men we don't like to admit those things, and that might be part of the problem.
Yeah, that's a fantastic point. We don't like to admit it, and we don't like to talk about it. So that's why it's really important to be able to open those communication channels, not only with the ones in our lives, but also our healthcare providers. There's a lot of questions about treatment and quality of life after treatment. So I'll move on to this section pretty quickly, but I just wanted to double check if Svetlana, you have anything to add in terms of most common symptoms, things men need to look out for in order to start that conversation with their doctor.
I mean, and again, as you can see, just from what Gog said right now, sometimes it's no real symptoms. Sometimes you need to just be aware that it could happen and really go to your regular checkups and sometimes discuss it with your general practitioner as well. But these symptoms could include like frequent urination. Sometimes it's discomfort. Sometimes it can be constipation. Irregularity of stool, basically bowel movements. Sometimes it can be pain as well. And in any case, if you feel that something goes wrong, you go urinate more frequent during nighttime, your usual habits changed, you need to ask your doctor and seek advice and ask what could happen, what kind of test should I pass, and basically PSA test would be probably the one you will need to perform. And as you said, you can look at it as 1 in 9 men, but you can say 8 men would be healthy. It means it's not always those symptoms would be the reason, and prostate cancer would be the reason of the symptoms. But to be aware and seek advice, it's the most important thing.
Great practical advice. Thank you. So let's move on then to cover off on some of these questions, especially as quality of life and treatment was the second highest ranking poll result. So let's start a little bit with Ian. Did you suffer any negative consequences of prostatectomy? And can you talk a little bit about how the treatment helped you and if there were any life changes afterwards?
Thanks, Rob. Yes, I had some very detailed discussions with my urologist because I have a background in the health professions. I came armed with a lot of questions about the surgery and what that would mean for me. I was most concerned about the loss of bladder control as one of the side effects of the surgery, and also what it would do in terms of my sexual lifestyle with my partner, Judy. And he was very good about explaining both of those things, and he explained very carefully the type of surgery that he did, which at the time in 2006, I had an open prostatectomy, which is a fairly major surgery. More recently, a lot of men are having robotic surgery, which is quite different, and the recovery rate is a lot higher. But he was very confident that he could ensure that any risk of incontinence post the surgery would be minimised, if not eliminated. And secondly, he said, when I actually get in to see the prostate and take the tumour out, I'll try to spare the nerves that help you with your erection and sexual activity, and if at all possible, I will spare them. He did manage to do that on one side of my prostate, but not the other. So I did have some sensation return at a later date after the surgery with regard to my sexual activity, but it was limited, and I had difficulties with erections, and subsequently I wasn't able to continue my sexual activity as I had done prior to surgery. As I said earlier, I eventually had radiation therapy also, which probably did perhaps further damage to the remaining nerves, and as a result, I have not been able to have erections since the surgery or the radiotherapy. But I've managed to get on with my life, and I have a life, which is a big plus. And I've been able to enjoy many, many other things in life, and I don't have the incontinence. That was one of the things that I was extremely grateful to my surgeon for. He was able to ensure that my incontinence issue, which is a problem for many men that have this type of surgery, wasn't something in my life.
Great, thank you. Definitely sounds like you've gone through quite a lot. Judy, can you share a little bit about how that impacted you, your health, and your relationship with Ian?
Yes, thanks, Rob. Yes, I felt quite sad initially at the loss of a really healthy sexual relationship with Ian, but I quickly realised, of course, that that is just one aspect of a good relationship. And so together we moved on and focused on the things in life, like, finding or making time together each day to, have maybe just a coffee down at the local cafe, and going for walks and doing other things. So we strengthened our relationship anyway in other ways. And I guess in terms of my health, even though, I experienced some sadness there and concern about Ian and also the impact that would have on our son, because clearly that might mean a big change in their own health. I guess I had to try and put aside the anxiety about that and focus on doing positive things with Ian and on my own with friends as well, and exploring just other ways of improving our lifestyle.
Lots of retail therapy.
Great points about the emotional and relational intimacy and staying positive and focusing on what you can control or what you can impact, and really being there to support Ian. Gogs, can you share a little bit about what changed in your life in these past 2 years and maybe how that has caused you to become a little bit more vocal about your prostate cancer and journey?
Sure. Well, excuse me. I opted for an open prostatectomy as well, and I was quite concerned about the potential side effects of urinary incontinence and erectile dysfunction. So I had in-length conversations with my urologist about that. And so I understood there was these two bundle of nerves that run along each side of the prostate that he would attempt to spare, but it would depend on if they were healthy and if they weren't yet invaded with cancer, and he would do his best. So I took that risk, and I also did a lot of Kegel exercises before. I understood that if I did that before surgery, it would help strengthen the floor, the pelvic floor muscles. I did them every day, but I wasn't quite sure if they were effective, and I wouldn't know until after the surgery. So I went in for the surgery, and I woke up quite alert. And the first question I had from my surgeon, I was very anxious to know about the erections. I didn't ask him how the surgery went, and I didn't ask him if there was any complications or were you able to get all the cancer out? No. My first question was, were you able to save my erection nerves? And of course, he said that he did, but he warned me, they're traumatized and they may take several months or several years. With the possibility they may never work the same or never work again. So I was fortunate. 17 months later, a good 17 months, my erections did return. However, they are not the same. They are not as spontaneous as they used to be. And they don't always are. So I do find that I have to spend a lot more time on romance with my wife and more on intimacy and foreplay, and rather than I'm not good just out of the gate anymore, let's say. And as far as urinary control, I was quite anxious to get the catheter. I had the catheter in for a couple of weeks. I was quite anxious to get it out. I was lying on the table. The doctor deflated the balloon and pulled the bladder out, and I had to look down. I couldn't help but look, and I noticed that there was no leakage, but I think that's because I was lying down. When I stood up, there was leakage and a burning sensation. But I was very fortunate because within 6 weeks, my urinary control came back, and actually my flow was a lot better than it was before. So I think maybe my flow was an indication that there was something wrong before. So I'm quite happy with the urinary control, and the erections are still there, but they're certainly not what they were before. And again, I'm much more closer with my wife because I'm kind of forced now to spend more time on romantic activities.
Great glass half full and the learnings that you've had throughout. Thank you for sharing.
Right.
Svetlana, could you talk a little bit perhaps about the treatment decisions, consequences, and especially how quality of life can play into that and how you want to have those conversations with your doctor?
Yes, definitely. First of all, I would like to say, and it depends on, I would say, physician you see first, but sometimes multidisciplinary team, basically in decision among different specialties, radio, I would say therapist, surgeon, And sometimes oncologists could be very helpful because the stage of the disease after biopsy could determine the right sequence, I would say, of events. Nowadays, you can define your risk of recurrence or progression in 5 years by doing genetic testing. It's a special score, Decipher score, right now available. And sometimes, in some cases, after radical prostatectomy, some physicians, your urologist could actually recommend doing this type of testing. That again would determine what type of treatment or watchful waiting would be the next, I would say, stage in your treatment. And I can tell you, I think the following advice of the multidisciplinary team, your urologist, your surgeon, your physician is extremely important in your journey. You always, and for some patients, it would be recommended to seek a second opinion, and it's fine. You're not, I would say, anyhow changing your relationship with your initial physician or your surgeon. But if you have any doubts, you have to do it as well. And I think it's important to have you to confirm what your path would be in the treatment fighting this disease. Another comment I would like to make, I think seeking advice from supportive groups, not only from your relatives, sometimes it's a key. Because I think, again, quality of life and your mental health could be extremely, extremely important. How you look at your treatment and how positive you keep being, actually, to be sure that you take every steps that needed and you're confident that you actually living your full life and full potential. That's still positive despite of adverse events of surgeries, despite of treatments. And it's another, I would say, chance that could be given to patients to understand very well the options and to keep, again, understanding of and mental health, I would say, in a good spirit and good mode. I think this is important.
Absolutely. And I think we can cover off on that in a little bit when we talk more about the practical tips for what to do for men in your lives. And that's really an important piece to land on. Just wanted to point out that, again, we're very thankful for everybody that's joining us for this live chat. We've got over 60 countries represented with really high engagement. And we understand that sometimes the quality of sound and video might go in and out a little bit, and we're just thankful that we can have this live stream in times of COVID, and especially because we've got on our panel represented, we've got Canada, Australia, the US, and as well as a tech team that's based out of Germany, so trying to do our best globally as well. So let's go back to more of the conversation. Ian and Gogs, can you talk a little bit about where you feel you've adapted and where you still feel there's opportunity to improve your health? Maybe Ian first and then Gogs.
Okay. Thanks, Rob. I made the decision fairly soon after the surgery and the radiotherapy that I was going to engage with life full time and drink deeply from its cup. Yes, there was some trauma associated with the surgery and the radiotherapy. In my case, of course, that neither of those procedures eliminated the cancer. And 3 months after the radiotherapy, as I said, my PSA was rising again very slightly, which meant that I still had circulating cells. I took the view about my cancer that it's something that I shouldn't hate. They are my cells. I grew them. I cultured them. They are rogue cells. They're behaving in a way that they shouldn't behave. But I never really hated them. I just believe that I need to control my life and be as healthy as I possibly can to ensure that I'm around for as long as possible, and that whatever treatment modalities come along after those initial treatments I would grab with both hands, and that's essentially what I've continued to do. I've continued to look for opportunities. Yes, I did retire. I was the same as Gogs, 57 years of age when I was diagnosed, and so I did retire early in 2007 and returned to Australia. But since that time, I've been heavily engaged in bike riding, in photography, in community events, in volunteering with the local firefighting brigade. Lots of activities with my family, especially with my grandchildren. I've seen my grandchildren grow, which is a wonderful thing. So I think the lesson for me was to push on, to grasp opportunities as they came, and to live life to the full.
For me, being diagnosed, when I was diagnosed, it was completely devastating, and I had no plans to write a book. I had no plans to talk about it. I just wanted to curl up a ball. I thought my life was over. I really thinking about it now, I really overreacted because I didn't even know anything about my cancer. I didn't realize there was more tests to go through, and there was lots of research and lots of options to consider. But one thing that I found that helped me tremendously was to write. I just started writing a journal at first, just to kind of get things off my mind out. And I really had a great support from my wife, who encouraged me to talk about it and come out, because I was really shut down, and I really, I even felt embarrassed. I thought it was my fault somehow, and but just writing. So I would really recommend just writing your thoughts. And at first, I wasn't even going to share my writing. It was just personal for me, helping to get me out of my shell. And then eventually, I had all kinds of coworkers calling me and friends and asking me how I was doing. And so I decided to share my private journal with them. And then from there, it kind of took off. But and even now, I continue to write and articles, and I speak at various cancer support groups. And it's just extremely helpful for me anyway, just to talk about it and not hold it in. Because I know growing up as a man, we kind of tend to hide our emotions, and we're taught not to show our weaknesses and don't admit that we're in pain. But that type of behavior is not really helpful, and talking about it is tremendously helpful. So that's my coping mechanism.
Absolutely. Community and social support are critical. So, Judy, perhaps I'll ask you if you have any tips for others who care for their loved ones in terms of staying informed, early detection, diagnosis, treating, and really just being there for the men in our lives.
Thanks, Rob. Yes, I think there are quite a few tips. One of the things that I think is critical is to have a really open communication in your relationship. If you haven't had that in the past, I think you need to learn to develop that. And if you have, then you enhance it. I think it's absolutely critical that you have open discussion about the cancer diagnosis and the treatment journey, because that supports your partner and it helps you as well, because you are informed all along the way then. At the same time, I think we need to acknowledge that the cancer journey for our partners is a lonely one. So whilst you want to foster open communication, it's still lonely for them, and you have to allow that. You can't change that. You can be there for them, but you can't change that. They have to also experience that, which is tough. The other things would be counselling, if you wanted to do that as a couple or even as individuals, and counselling with, professional counsellors or psychologists, or with your doctor. I think that's an important avenue to pursue. Additionally, I think it's important to attend appointments with your partner. So go to doctor's appointments, ask questions, write them down first if you think you can't remember. Because when you're faced with these situations, often it's a situation of information overload, and I think writing things down is very helpful. The other things to do are to make time for yourself each day, to do things to foster your own mental health, and that might be yoga, meditation, walking, that kind of thing, activities that you enjoy doing on your own, and maintaining good friendships. So I think that's it in a nutshell. Thank you.
Very helpful, thank you. And especially as you think about the open communication, not only with Ian, but also with your sons, how do you support your sons during this time, knowing that not only have they had to go through that looking at Ian as their father, but looking at themselves as somebody who's potentially at risk? And what do you do about the PSA testing and their conversations with healthcare providers?
Thank you. Yes, very good questions. We have always had a very open relationship with both our sons. We have always talked about life events very openly. And because we both come from health backgrounds, perhaps that's made it a little easier. So we continue that every time Ian has a PSA test or he has his 4-monthly oncology visit, despite the fact that, we might have some anxiety around that, we nevertheless always inform our sons of the visits coming up, the tests coming up, without being alarmist, and then informing them of the outcome. And they appreciate that, I think. They know that they are potentially at risk, and that they are now at the age where they will probably have to have some discussions with their doctor and perhaps a test early on.
Great point about the awareness and the education and the information really helping to make better decisions, especially as, again, early detection is really critical in terms of managing not only the treatment decision and the survival rate, but also the quality of life throughout and after. And especially with a lot of treatment options becoming available and new medical advancements, there's definitely more to read up on. Svetlana, do you mind actually sharing a little bit about what some of the most exciting and promising research is?
Yes, definitely. And again, first of all, I would like to say that it's, I think, comparing with even 10 years ago, prostate cancer patients now have actually tens or even more potential options throughout the cycle of their disease. And I'm talking about systemic therapies and treatments, basically not only hormonal treatments, but right now for patients, for example, with mismatch repair defects. And again, you need to have genetic testing. They call it microsatellite unstable tumors. It can be immunotherapy options available. It's a new, right now, for example, PARP inhibitors tested in prostate cancer. It's some other, I would say, novel targeted therapies tested. And I would like to, tell you, it's a lot of hope to make this disease really chronic disease, to be sure that majority of men would never die from this disease and would live life probably with some, I would say, consequences, but really in a good quality and long lives. And another comment I would like to make, that right now in a very, I would say, unfortunate or challenging era of pandemic, the healthcare providers doing their best to have, I would say, telemedicine visits, to provide special devices to actually collect information about symptoms, about how treatment should go, about monitoring the treatments. And I think this is another reassurance that in any, I would say, life events, if you like, in any, and especially where we live right now, we're doing this basically virtually, this event. Every single prostate cancer patient would need to be sure that basically healthcare providers very much looking to help, to provide help at any level, at home, consult at home, sometimes actually testing us sent home to collect samples. And it's something, and nurses sometimes going home to collect samples. It means don't be concerned or afraid, always seek help, seek advice. And I think this is the probably most important. And be sure that in any case, in any stage of diagnosis, the treatments are there to help to, and actually it's a lot of men who are cured from this disease that I think is very encouraging as well.
Fantastic point about prostate cancer moving more towards a chronic care, lifestyle management, personal self-management healthcare model. And definitely throughout the journey, again, like Judy mentioned, it's really important for the man to not only become informed, but become their own advocate, to start having those conversations, raising those questions, and bringing it up to advocate for themselves or to others in their lives. So even if the doctor may not be as up to date on medical treatments, clinical trials, new advancements in research that's going on, as you know the information, you can bring it up. And that's really the power of being on panels like this, or hearing panels, information from panels like this. So really appreciate that. Gogs and Ian, I'd like to ask a little bit about your key recommendations or key resources that helped you throughout, and especially as Svetlana mentioned, things that have helped you now and things that you are looking for help now. Let's start perhaps with Gogs and then going to Ian.
Sure. The number one recommendation that I would have is when I was first diagnosed with prostate cancer, I didn't realize that I went into a state of shock. And I immediately thought the worst. And I immediately thought my only hope was surgery, without even knowing anything about my treatment, anything about my case, anything. And what I had realized afterwards was, when you're in this period of shock, you need some time just to recover, just to sit back and try to process the information. And during this recovery period of just knowing you have cancer, it's not a good idea to make decisions, especially life-altering decisions. First of all, you don't have all the facts. There's still more tests to be done. You're not thinking clearly. So the number one thing is to recognize that you're probably going to need some time to recover. Now, for me, my urologist told me to slow down. He didn't even know if surgery was an option because there was still other tests to do. But in the back of my mind, I think I already made that decision. Now, I did research other options, but I don't believe my mindset was correct. I think I was a little biased, and I had already made up my mind, so I was going to have surgery anyway. So that's something that you really want to try to be open, because there's a lot of options out there. And you need to, first of all, understand your specific case. You need to make sure you have a clear mind, and you need to seek multiple opinions. You do need to see radiation oncologists and oncologists. You need to speak with other people who've gone through it. And it's a big decision. And I understand what it's like to get a cancer diagnosis, and you might feel this urgent need to deal with it right away. But I want men to make the best informed decision as possible. And the only way to do that is to do your homework, and it takes time. So that's my big recommendation. Was there a two-part question? Oh, resources. Yes, there's a lot of great websites, I think, out there. However, there's just you want to make sure you stick with reputable sites. You can become overwhelmed with information very easily. And that's why it's important to stick with medical professionals and seek more than one particular, see more than one doctor. So yeah, there's lots of great resources online, and also there's a lot of great books out there as well. But I don't have any one particular resource that I would point to. There's a lot of great ones out there.
Thank you, Ian.
Yes, I found myself nodding a lot as Gogs was going through his key recommendation. I think for me, information is power. It's a much used phrase, but again, information is particularly nowadays, it's a lot like drinking from a fire hydrant. There's huge amounts of information out about prostate cancer. Since even in the 10 years, as Svetlana was saying, there's been colossal amounts of progress made in prostate cancer across the world. And when I was first diagnosed in 2006 compared to today in 2020, there's a huge amount of information, there's a huge amount of treatment option. There are a lot of people out there, researchers and drug companies that are trying very hard to crack some of the most difficult problems associated with prostate cancer. Prostate cancer, I think, for men started behind the 8 ball compared to breast cancer. Women were a lot more proactive about breast cancer globally than men have been about prostate cancer. And so the resources that women had for breast cancer and the treatment options consequently have been a lot more advanced. But men's prostate cancer is certainly catching up through support from large multinational companies like Bayer and others, and certainly the Movember Foundation's work around spreading good quality, high quality information to men about prostate cancer is a great step forward. So I would certainly echo any man who is facing a journey with prostate cancer to look at the best quality available information, talk to as many people that you can, certainly talk to your partner and your family before you make those decisions, as Gogs was saying, about your ultimate treatment option. And enjoy the journey. It sounds strange to say that, but along the way I met very fine health professionals who had my best interests at heart, and I felt confident trusting myself to them on the journey.
Great. Well, glad you guys have found some good support, and definitely agree that information is power. And to what both of you guys have pointed out, Gogs and Ian, is that there is a lot of information out there. If you do a quick Google search, you're going to get millions of hits. And so that's where, as we look at Movember True North, it's not just about providing information, but making it easy to use, easy to access, and then building around it an experience that allows you to get a little bit more personalized, tailored information that can help to guide you throughout that journey. And so really excited for True North to develop new products coming up in the next year around sexual well-being and health and exercise and diet and lifestyle. So I want to take a few minutes here just to make sure that everybody has a chance to share some good closing words of wisdom, anything that you'd like to share either to men who are at risk or going through this journey, or those that are supporting them. And so we'll go maybe in the same order as the introductions were, starting with Gogs and then going to Ian and Judy and then Svetlana.
Yeah, so, well, one thing that I would definitely do differently, and I would recommend to all men, is when you're diagnosed with prostate cancer, one thing that I would have done right away, right from the get-go, is join a prostate cancer support group. Even before making my decision, even before speaking with other doctors, I found it it's a very bonding experience. Now, at first, I didn't want to go to a group. I didn't want to admit I had cancer. I didn't want a bunch of men patting me on the back, feeling sorry for me, but I totally had the wrong idea of what a group was all about. It's just a bunch of great guys sitting around the table, and we don't always talk about cancer. Sometimes we talk about the ball game or the weather, and it's just very bonding, and you really recognize that you're not alone. So I would say look up support groups. That's my big wisdom.
In my case, I guess I was aware when I was diagnosed in Canada that there were support groups, but at the time I didn't access them, not for the same reasons that Gogs has just outlined, but I just felt that I was fortunate enough, being in the health professions, to have lots of access to good quality treatment and colleagues who were experienced in managing this disease. So I probably spoke with a lot of them at length. Certainly, I agree about the discussion about your condition with others is very helpful, and I've maintained that I don't have any problems talking to anybody in my family or outside my family. The cycling group that I ride with, a group of men in their 70s, they all know that I have had prostate cancer or have prostate cancer, and they know my treatment journey, and some of them have been on a similar journey, going back to Rob's earlier comments about the association that individuals have with others that have cancer. It's quite common. So I feel that talking openly about your condition with your family, with your friends, and anybody else who'll listen is therapeutic. If you feel comfortable to do that, the information is important, as I've stressed already. Small things, I've kept a small little handheld book, and in that I write appointments and tracking of my results and those sort of things. I find I've still kept that book. It's now 14 years old, and there's a lot of information in it. I can always refer to it when I need to. And so I think keeping those small reminders of your journey close at hand are helpful.
And I think from the Gogs made, Gogs made a very good point on initial diagnosis, sending him into shock. That's absolutely very common and very normal. And I think equally important, you need to have time to work through that and listen to the options for treatment and get a lot of supportive people around you. So that's really important. The other thing I think, just to wrap it up, is to make sure you foster really good, strong communication with your partner and with the rest of your family and also your friends, and to look after each other, but also yourself, and maintain good mental health if you can.
Yes, probably I can say a couple of words as well. And I would like to give a commitment from Bayer that from our side, our chemists, researchers, scientists, and all of us will continue invest our, I would say, brain power, our knowledge into discovering new treatment options for cancer patients, and especially patients with prostate cancer. We will continue to work with different patient groups like November and a lot of other groups. And we are here to provide help, education, and support to every single patient with prostate cancer.
Thank you for that commitment, Dr. Kobina. I guess my closing words of wisdom are really to underscore what Gogs mentioned, that you are not alone. So there are those around you that you can have a conversation with, and the conversations are really what is important. So thank you very much for having this conversation. Thank you to our panelists, and thank you for the thousands of people that have joined us from over 60 countries, and really encourage you to continue to take this forward and to share information, share resources, have those conversations, and really be there for the men in your lives. Thank you so much. And again, thank you also for Bayer for putting this together.
Thank you.
Yes. Thank you so much for the opportunity.